Hi guys, it's Jason Duff from Small Nation, and today I'm here with Andrew Brewer from Prescription Bliss. And Andrew, I've had the chance just to get to know him better in the last few months because he is one of the newest businesses in downtown Bellefontaine. Andrew comes from a background in business and made a career change to actually start and create a startup that's helping a lot of people with prescription drugs and healthcare right now. Andrew, it's great to be interviewing with you today.
All right, thanks for having us, Jason.
Yeah, you got it. Well, so you originally were from Bellefontaine, and then you've kind of had a few different careers in the past. Can you explain, where you've been, and now you actually have your business back in town?
Yeah, for sure. So prior to Prescription Bliss, we actually worked for corporate companies, and I had a various background in benefits, HR, talent management, EHS, so on and so forth. But more recently, as I was more involved in projects looking at benefit packages, I guess it became more prevalent that we had an issue within the United States as it relates to prescription drugs. And I just found that there were a lot of individuals that just could not afford their medications. And so, I came across some individuals that needed help, and we started studying what kind of programs are available out there for individuals to take part of and really subsidize or lower their cost of those medications with the end goal of getting that individual to adhere to their medications as required. So we found that there was roughly around 250 to 270 different programs out there that were just not well known for individuals. And so what we really started doing was before we even incorporated, we started helping individuals really navigate them to some programs that would help them. And so, and what I found personally was that really just struck a nerve. It really was just very fulfilling to know that we were able to get an individual on their medication that they needed, in some cases, to survive. And so, in 2018, we decided to incorporate. We founded Prescription Bliss, and we started helping individuals just like that. A lot of the individuals that come to us, Jason, don't have insurance. Some individuals do have insurance, but they just have a high copay, and so at the end of the day, they're just not picking up their medications because they can't afford them. And in some cases, some individuals come to us that are on Medicare. And so again, maybe they have the Medicare Part D plan, but the Part D plan still is not covering, their medications to a point where they can afford them. So that's kind of how it came about.
Well, I'm happy that you're solving those important issues, and there isn't a family that is not touched by the challenges and confusion sometimes of navigating the healthcare system, and particularly with prescription drugs. When your doctor prescribes it and you take it to a pharmacist, some people don't understand that there are different options and costs associated with buying those drugs. Just kind of sharing some general advice. What is kind of the first line of defense to really navigate and understand the cost of your drug? Is there any apps or is there anything that you recommend that maybe someone when they first get that prescription that they see what their options are?
Yeah, no, that's a very good question. So, a lot of people are familiar with GoodRx, and we even use it today. There's some individuals that come to us that may not qualify for any programs that we have, and what we do is we really just try to look at each individual uniquely and determine what other programs are out there that may help them lower that cost. And GoodRx is one of those. And so very quickly, an individual can go online via their phone or their computer, go to goodrx.com, type in the medication, and you can even filter it by how often you're taking that medication, 30-day, 60-day, 90-day supply. And it's going to quickly compile, several results, either through your local pharmacy, through some of the more well-known, like the big box, like Walmart, Kroger, and so on and so forth. and tell you what the price of that medication is going to be. And so I always tell people, if you want to have a general understanding of what that medication is going to cost, GoodRx is a pretty good resource to get an understanding of what you may be looking at when you get to the pharmacy. Now, of course, if you have insurance, some of those factors are going to play into the cost of your medication. And so generally speaking, if you want to know what the baseline price of that medication is going to be, again, GoodRx is generally a pretty decent resource to understand what you're looking at, from that perspective.
Right now, a lot of people with what we're dealing with the virus are watching the news. They're trying to digest the information. They're trying to make smart and healthy decisions. They're also concerned about their jobs and their healthcare. So, related to the types of services that you provide, are you helping people that are both can you help people that are both insured and uninsured?
Yeah, absolutely. So, as I mentioned early on, a lot of the individuals that are coming to us have had a change in their situation most recently, mainly due to, becoming unemployed. And so they had benefits and now they don't. And what they're finding is that when they go to the pharmacy now, they don't have that insurance and they're getting hit with the reality of the cost of that medication. And I can just tell you, a lot of the medications that we help clients with are insulin. Insulin tends to be a very high cost medication. Inhalers is another one for individuals that suffer from COPD or asthma. Those are two medications right at the top of my head that are very, very expensive. And so to answer your question, yes, we can help individuals that have no insurance. Maybe they have insurance, but again, they're faced with very high copays. And then finally, there are some cases where we can help those individuals that, are on Medicare.
And, when people think about drugs in general, I know some folks really want, when they're prescribed something, they maybe don't want the generic, or they have a different interaction to that. Excuse me real quick here. That's the nature of us being crazy. The nature of the drug itself, is there options if they want to keep the name brand drug versus the generic, or how does that handled with your program?
Yeah, no, that's a great question. There are some options there. So most of the medications that we're helping with are brand name medications. There are some instances where a physician may recommend a generic due to the cost, but as you mentioned, sometimes that generic is just not as effective as the brand name medication. So what we're really doing is, we will do our best to get that individual approved with the brand name medication. But in some cases, if the individual is not eligible for the program that offers the brand name medication, sometimes we will work with that individual by saying, hey, there are some other options that are populating, and ultimately, seeking the physician to talk to them to understand if those generics or other insulin is one that comes to mind, because there's many, many different types of insulin medications that a patient can be on. So really, it's just, again, as I mentioned, just from a hybrid standpoint, just taking a look at the entire picture and really trying to navigate that individual to a program or to the lowest cost medication as possible that's going to be just as effective as what they had before.
Makes sense. Yeah. And then what is the best way for people that want to get more information or to figure out how to maybe, find out if they qualify? Do you have a process for that?
Yeah, absolutely. They can either call us. They can call us at our toll-free number, which is 877-RX-BLISS or 877-792-5477. Or maybe the easiest way, if you have access to our website, would be going to www.prescriptionbliss.com, and there's a lot of information on there, and there's an enrollment form on there as well. And so, if you just want to understand, am I eligible for these programs, you can certainly reach out to us via phone or online.
That's great. And then, I know one question that comes up a lot is like, what are the charges to enroll and be a part of your company or your services? Does it vary based on the client or the drug, or is it kind of a flat fee arrangement?
Yeah, that's a great question. So, the model that we have is really we'll help you with as many medications as you have for a flat fee per month, which is $45. So what that means, Jason, is you can really come to us with 3 or 4 different medications. And if I have programs for all 3 or 4 medications, there's not going to be any additional fees for that. And there's a lot of people will say, well, okay, I understand your service is $45 per month, but what is the cost of the medication? The beautiful thing is there is no cost to the medication. The medication is completely covered by the pharmaceutical company or the program that we get you enrolled in. The only thing that you're paying is that $45 per month, which is up for us to manage your enrollment and manage and track your ongoing refills.
And in some cases, do you just have things that you're proud of, saving money for your client? I imagine you've got someone that maybe you're saving hundreds, if not thousands of dollars, and then some that, maybe just more than the fee that they're paying per month. But
Yeah.
have you looked at, any success stories that you'd like to share between, how you've been able to help people?
Yeah. I almost tear up, when I talk about these because, we're really invested in the client and making sure that, they're helped in some way. But I had a gentleman out of Louisiana. He was impacted, lost his job. His wife was still working for a medical office, and he was on 3 different medications. And, we knew the medication cost was high, but without having that insurance, he was going to be looking at out of pocket of around $4,500 per month. And that is just unbelievably hard for anybody to afford, something like that out of pocket. But what we were able to do is we were able to successfully procure all 3 of those medications through 2 different programs. And now he's only paying $45 per month. And so you can imagine the relief that is not just for himself, because now that he's able to adhere to that medication, but for his entire family not having to take the burden of that cost. More recently, we had an individual locally here that was on an insulin medication, and actually today his medication just shipped out, and so that should be arriving at his physician's office within the next day or 2. But again, that insulin cost was upwards of around $800 to $1,000.
Wow.
So at the end of the day, they're just going to be paying, the service fee of $45 per month, and really not having to worry about how they're going to get their medications or how they're going to get groceries or anything like that. Because a lot of people, that we come in contact with are really trying to make that tough decision. Do I get this, my medication, or do I get, groceries or pay the electric bill? And so those are decisions we want to take away from the individual and really just help them out in any way we can. So
It's huge. And, as someone that is responsible and has worked on providing my group employees healthcare coverage, I know that, every year we're faced with knowing what is the renewal going to look like and what tough decisions are we going to have to make with what insurance provider will even provide us coverage and at what levels and at what cost. Is there anything that you can do to help small businesses with their group health plans and helping optimize those enrollees in saving as much money as possible for what programs may exist out there?
Yeah, no, that's a great question. I'm glad you brought that up. So we do look at employers' annual RX spend, and Jason, what we find is that as you look at the population of a small business, and you look at that entire cost spend, it's really not everybody that's really driving that cost up. And what we're finding is around 6 to 8% of the population has very expensive medications that's really driving that cost up. And so what we do is we're really not replacing what you currently have in terms of healthcare, but what we can do is come in and say, let us carve out that 6 to 8% of that cost, and get those individuals enrolled in various programs. And at the end of the day, the small business is not going to have to take on that cost for, high premiums, or in some cases they're self-funded. And then, on the flip side of that, the individual now is adhering to their medications. They don't have to worry about that high cost or that high copay, depending on what their plan entails. And so, really, it's a win-win situation, not just for the individual, but for the employer as well.
That's huge.
Yeah.
And I think even more, now that we're, watching every dollar and every penny to make sure that we're preserving that to keep our businesses strong, it's great to know that you've got those options and solutions
Absolutely.
to maybe help other small businesses and group health plans. And the best way is that typically connecting, maybe if that company has a small HR person or the owner of the company, just to contact you, or what's typically the process or best way for a small business to reach out and see what ways that you can help?
Yeah, absolutely. They can either call us again at that 877-792-5477, or we do have a form online where it basically, it's a drop down, just says, are you an employer? And it's just going to ask for some basic information, who you are, how many employees you have, and then we'll be in touch with that individual. Generally speaking, sometimes we'll work with a third-party administrator or the HR person to really just dial into, what is it they're spending per year in terms of RX costs, and is there an opportunity to help save, again, not only the individual, but the employer money.
Awesome. Well, you provided so many great insights today, and I just appreciate, I know right now having a startup and opening up a new office, and all the steps that you have been taking, and it takes a lot of courage to do those things, but even more when you've got a mission for how you can help people. And I think getting up every day and having a business that you can kind of look at your customers in their eyes and know that you're making that positive difference and impact is really huge. So I'm excited to see that things continue to grow, and that I know, we're all practicing new habits of working from home and social distancing, and we all want to be healthy again. So just thank you right now for your message and the great work that you're doing.
Thanks so much, Jason. We appreciate it. We really do.
Yeah, awesome.
All right.